Hi everyone, I'm Namita Jain, a wellness specialist and a wellness author. I am at Bombay Hospital in Mumbai and I'm delighted to be in conversation with Dr. Rajeev Nerurkar, a leading ENT surgeon. Doctor, the subject which I would like to discuss is sinusitis.
Yes.
A lot of people have sinusitis and they're really uncomfortable. It causes fatigue, maybe a blocked nose and mucus and all that could cause discomfort and fatigue. So, what do you think is the main cause of sinusitis? Allergies, lifestyle? What do you think?
Sinusitis is a very common disorder that we see nowadays, and typically cold is what everybody has, but when the cold persists for a longer period of time,
Yes.
then that becomes sinusitis. Now, how we diagnose this, or how you come to know that you may have sinusitis, is you start getting headaches after a cold, or you start losing your smell after a cold, you get some pain behind the eyeballs, facial pain, and nasal congestion, nasal discharge. Then you term it as sinusitis, and then you know that you are suffering from sinusitis and not just allergic rhinitis or a common cold.
So a lot of people who have sinusitis do home remedies such as take steam inhalations. They may take vitamin C, have a little more water, try to figure out if they're allergic to something. Is this the right way to go? What do you recommend?
Well, I think initially it's a right strategy that you should
Yeah.
follow, because you want to do home remedies as much as possible. You don't want to rush to a doctor every time that you have a problem.
Right.
So these home remedies are good, but when symptoms persist for more than, let's say, about 2 or 3 weeks, then that's the time that you should start treatment for sinusitis, and you should go to a doctor and see whether it is sinusitis and then treat it accordingly.
So when you talk about treatment, basically would you say it's medication or even in some cases surgery that is required?
Surgery is really rarely advertised,
Okay.
rarely advised for sinusitis. Typically, it would be nasal decongestants, nasal steroid sprays or nasal decongestant sprays, then anti-inflammatories, and if there is mucus and pus coming out, then you need to start antibiotics.
So a final takeaway message for the viewers who are looking for something from sinusitis, would you like to add something to this?
Well, I think hydration is very important. Don't ignore your common colds or allergic rhinitis. So common cold and allergic rhinitis you need to prevent by wearing a mask outdoors, because I think it's become a necessity now that the amount of pollution that we live in. And also at home, if it's possible, to use purifiers. So purifiers at home and mask outdoors, you are pretty much covered. And then and if you are unfortunate to get it, then I think you need to start medication.
Thank you so much, doctor, for this wonderful takeaway, and I'm sure a lot of people who are suffering sinusitis would love to hear this video and watch you.
Sure.
Thank you so much.
Sure, pleasure.